Have you ever wondered just how profoundly the world has changed since the inception of the COVID-19 pandemic? Today we cast a spotlight on the global impact of this ongoing health crisis. The tale begins in late 2019, with the first reported cases of a novel coronavirus in Wuhan, China. As the virus rapidly spread, the World Health Organization declared a public health emergency of international concern in January 2020. By March, the situation had escalated into a global pandemic. Countries worldwide implemented unprecedented measures to contain the spread. Entire cities were locked down, international travel was heavily restricted, and healthcare systems were pushed to their limits. Despite these efforts, by the end of 2020, the virus had infected tens of millions of people and claimed the lives of over 1 million globally. The pandemic's impact was far-reaching, extending well beyond the immediate health crisis. Economies around the globe buckled under the strain as businesses large and small felt the pinch. Major corporations and long-standing industries, once considered immovable, found themselves reeling from economic blow. Small businesses, the lifeblood of many communities, were dealt an even harsher hand, with many closing their doors indefinitely as demand fell and restrictions tightened. Unemployment rates soared, reaching unprecedented highs in countries across the world. In the United States alone, the economy suffered contraction of 3.5% in 2020, marking the most significant shrinking since the aftermath of World War II. The stock market, typically a barometer of economic health, reflected this dire situation. After an initial nosedive in early 2020, it experienced a volatile year filled with unpredictable highs and lows. The pandemic's impact on global trade was equally catastrophic. Supply chains were interrupted, import and export activities were hampered, and goods movement slowed dramatically. International trade fell by an alarming rate, affecting economies worldwide. The domino effect of these impacts has been a global economic slowdown of a scale and speed that is unparalleled in history. Globally, the healthcare sector was brought to its knees. Hospitals from developed to developing nations found themselves swamped with patients, their capacity stretched thin in the face of the surging pandemic. This unprecedented situation spiraled into a dire shortage of essential medical supplies, from personal protective equipment to ventilators. The risk of infection lingered heavy in the air, taking its toll on the healthcare workers who were on the front lines of this battle. As the pandemic raged on, there was a significant hike in healthcare worker fatalities. These were the men and women who were the first line of defense against the disease, their loss a devastating blow to the global healthcare system. The demise of these brave frontline heroes not only resulted in a deep personal loss to their families and communities, but it also compounded the strain on an already overburdened healthcare infrastructure. Furthermore, the challenges in providing adequate care became even more pronounced. With hospitals operating beyond their means and healthcare workers stretched to their limits, the provision of quality care became a daunting task. Patient care standards were put at risk, leading to a significant concern about patient safety and treatment outcomes. The challenges the healthcare sector faced were indeed multifaceted and required a coordinated global response to overcome. Education systems across the globe were thrown into uncharted territories, as the traditional classroom-based learning model was abruptly replaced with remote, online formats. This overnight shift in the paradigm of imparting knowledge was triggered by the need to prioritize health and safety over physical interactions. From kindergartners to university students, every category of learners faced their unique set of challenges. Younger learners, who thrive on social interactions and tactile learning experiences, were restricted to screen-based interactions. High school and college students grappled with the lack of structure and the nuances of self-study. The sudden shift not only disrupted their academic progress, but also brought forth a surge in mental health concerns, with students struggling to adapt to the solitude and seclusion of the new normal. Teachers were presented with the formidable task of devising virtual lesson plans and the complexity of managing online classes. Dedicated educators worldwide spent countless sleepless nights refining their teaching methodologies, grappling with technology, and ensuring no student is left behind in this digital transition. Parents too were caught in the crossfire of this educational disruption. Many juggled the demands of their work, childcare, and in some cases, homeschooling. The pressure was intense for parents who had to unexpectedly step into the role of an educator, trying to balance their professional commitments and their child's academic needs. The long-term implications of this massive swing towards remote learning are yet to be fully understood. While it has undoubtedly democratized access to education, with students from remote locations able to partake in learning experiences, it has also deepened the digital divide. The students without access to reliable internet or digital devices have been placed at a significant disadvantage. The impact of this educational disruption is far-reaching and multifaceted. It has reshaped the way we perceive and practice education, and its reverberations will be felt in the years to come. In 2021, the rollout of vaccines offered a glimmer of hope. However, issues with vaccine distribution, coupled with the emergence of new variants, meant that the crisis was far from over. As we near the end of 2023, the pandemic continues to shape our world in ways we could not have imagined. Mental health issues are on the rise, particularly among teenagers as a result of pandemic-induced stress. Economies are still recovering, and the healthcare sector continues to grapple with the fallout. In summary, the COVID-19 pandemic has triggered a global health crisis of unprecedented proportions. It has claimed millions of lives, disrupted economies and education systems, and put immense pressure on healthcare services. The mental health implications are vast and still unfolding. This journey through the pandemic underscores the interconnectedness of our world and the importance of collective action in the face of global crises. It is a stark reminder that the health of one is indeed the health of all. As we look ahead, the lessons learned from this pandemic will be crucial in navigating future global health challenges.